Hello, I'm Deborah Quilter and welcome to RSI Help YouTube. I was just talking with Dr. Nick Vizniak about the jaw and the relationship between jaw tightness and RSI. And I think it's good for everybody to know the connections. They're not always so obvious, but tightness here can often lead to tightness elsewhere. So here we have Dr. Nick Vizniak. He's a professor and clinician, professor of clinical anatomy. And he's the founder of Professional Health Systems in Vancouver, British Columbia. Welcome back to the show, Dr. Nick.
Thank you very much for having me, Deborah. Always a pleasure to be here.
Pleasure to have you. So tell us about the jaw. What can go wrong?
Yeah, so a lot of people take for granted healthy jaw movements where you can smile really big and go in a super big, and all this wide movement right here. And it's actually quite a complex structure located up here in your temporomandibular joint. So we'll take a second, maybe go over some of the anatomy, and then we'll talk about what goes wrong with it. But at the bottom, most significant in a basic level, almost everybody holds tension in their jaw. You can tell when somebody's angry because they have a very firm jaw, is the expression, right? They give you a hard jaw, and you can see people squeezing in on these temporomandibular joint muscles like your masseter, temporalis, your medial and lateral pterygoids on the inside, and all the other muscles that are deep down to it, that have incredible force around this joint when they're supposed to be working for when you're eating and chewing on more rougher food and things like this. But it goes a little bit too much when we're holding stress and issues like that in our jaws. So I have a fantastic skeletal model here that we can look at. Real human bone here that we're seeing. And if you're looking at the jaw is actually all of this running right through here. And then right up here is your temporomandibular joint. The temporomandibular joint itself is allowing the jaw to open and close back and forth.
Yes.
The interesting thing about this joint, though, is on the inside of it, there's actually an articular disc. There is a disc exactly like you have in your knee made up of fibrocartilage. So if you've heard of a meniscus tear, you can effectively have the same thing occurring inside of your temporomandibular joint.
Wow.
And so this clicking, this movement that happens can be the disc itself sliding back and forth. And what do we know controls all movement? Ligaments are the foundation, but the actual control of movement is done by all of these muscles around the jaw that are all designed to bite down. There's one muscle, lateral pterygoid, for our viewers who are into the healthcare professions, that does help pull your jaw forward. And then you have all the other supporting muscles down underneath your chin here, the suprahyoids, infrahyoids, even into the trapezius, SCM are all involved. So it is absolutely common to see people who are holding stress, who even have headaches. I mean, these cases are documented all the way back to Hippocrates, where he talks about patients being molested by headaches, is the exact words, because of the temporomandibular joint issues they have and potential dental tooth issues that are also potentially associated with them.
You know what else I've noticed now that you're talking about seeing the clenching of the jaw? Some people actually talk like this, you know, they keep their lower jaw forward, which is sort of puzzling to me. I don't understand that action or that choice.
Well, I'll talk about that for you because I lead a fairly physical life. I like to do a lot of combat type sports. And I was sparring with a good buddy of mine, Dr. Andrew Vargo, if you're out there. He initiated this injury for me. He basically had me held into a nice, decent headlock. I wanted to go this way. He said no. I said yes. And then he said no again. And I actually felt this side of my temporomandibular joint actually tear apart.
Oh.
It's a pain response is what you get from it. Okay, I'm fully rehabilitated. I'm okay. Everything's working fine. We'll talk about that here in a little bit. But at the end of the day, it was a strain and tear. I had to eat soup for about a week where I couldn't even, I was like, oh, hanging out like this. So when you say people make a choice, it's not a choice. It's a pain avoidance behavior is what they're actually doing because it's so painful to open your jaw. If you want a simple test to check what your range of motion and ability is for your jaw, it's called a 3-knuckle test. A normal functioning TMJ should be able to take 3 of your knuckles and fit them in between, and that should be a pain-free action right there. If you have better range, maybe even 4 knuckles can occur with that, but that's what you're looking for is good range.
How interesting. Oh.
So just a quick test. Now, another thing to bring up about this that a lot of people don't realize is even during dental work, that can be an area, never mind the sparring stuff. I give an example or a hit in the jaw or anything. During dental work, if your jaw is pried open and held open for too long of a period of time, this gives a very common initiating event of TMJ issues. And what would you guess percent of the population has TMJ issues? Anywhere from 10 to 25%. So a quarter of the people out there have TMJ issues that we want to definitely assess and look at for them.
That's so interesting. I didn't realize there was that 3-knuckle, 4-knuckle test for jaw health.
Yeah.
So interesting.
Mm-hmm.
So can you talk more about the relationship between the temporomandibular joint and the SCM and all this other, the anatomy of this area?
Yep, absolutely. So if you're looking at this region, all you have to do is look at any person and say, okay, what exists? The question that I always have my students know is give me a list of structures below my hand. So if we're looking at a certain area, you need to go ahead and talk about what are all the anatomy structures. Well, masseter is easy to find. People can relate to that. Just put your finger over your jaw and bite down, and you can feel that muscle pop out. But most people don't realize, if I go to the skeleton right here, most people don't realize, got to take off his hat, but most people don't realize there's actually a giant temporalis muscle that fills up most of this side of your skull and also comes down onto your jaw as well. These are the main ones that people think about, and a lot of our treatments are around those. There's other muscles on the inside of the jaw, but your SCM actually attaches to the mastoid process right back here and is right next to this temporomandibular joint. And as a basic body principle, whenever you have pain in an area, what's the body's response?
To protect it, to guard it.
Absolutely, to protect and guard. So what does it do? It locks down that area, and it locks down everything. Even neck movements change. Everything changes when you have pain in an area. And so it's common to see it start here as the main issue, but then it spreads out to corresponding areas, compensating areas to try and protect that area a little bit more. Even people don't even realize this. Something as simple as whiplash. When you're in a whiplash case, when you get hit and then you get rocked forward, the last part of the kinetic chain that actually moves is your TMJ that gets launched forward as well. Another common area for causative agent for TMJ issues. Now, where do your treatments need to start? If you want, you can go onto YouTube and type in Vizniak TMJ. We just posted a video, I think 2 weeks ago, 3 weeks ago, that shows a good half-hour treatment of a TMJ issue. And most of the TMJ treatment, yes, it's around jaw movements, but it also fades down into neck muscles. If you are not using and treating neck muscles further down, you are not giving a full treatment to a TMJ issue. If you have people who come in and tell you they can give you injection therapies and it's going to be cured just with that, there really needs to be appropriate rehab and neuromuscular retraining that occurs with all of this to give you the optimal outcomes.
So how would you relate TMJ and jaw tightness with repetitive strain injury, since the neck is really critical with RSI?
Yeah.
A lot of people don't realize that, but the neck is often the source.
Yeah, if you look at most people, where do we hold our tension? It's usually one of two places. And again, there's variations on everybody, but most people hold tension upper trapezius, where your trapezius runs exactly right up here into the back of your neck and also to your external occipital protuberance. And we also hold tension in the jaw. When people are under stress, what do they wind up doing? They wind up clenching their jaws tight, okay? If somebody says something you don't like or something bad is happening, what do? I can see it in my little 5-year-old when she throws a temper tantrum. She'll be sitting there and she'll be fine, and you see the jaw goes really tight right away. You do this in your sleep. So think about it. You go to sleep, you sleep your 6 to 8 hours at night, and many of those hours can be filled with actually grinding of the teeth. The technical terminology for it is bruxism, and people who are suffering from these issues grind in the night even. So dentists can see it as the wear pattern on your teeth. They can wake up and feel it in the morning because it feels like these muscles are on fire. They've been overworked from a repetitive strain injury in your sleep that you can't even control unless you can find ways to modify the symptoms that are causing the stress in your life.
That is so interesting. It's so interesting to learn all these things about parts of the body. One of the things that fascinates me that I learned in my Feldenkrais training was that the jaw has anti-gravity muscles.
Yep.
Because if it didn't, you'd be walking around with your,
yep.
Can you tell us about those anti-gravity muscles that are holding us?
Yeah, exactly. So anti-gravity muscles, you got to think where you are. What is the resting tone in muscles? A lot of muscles in your body have next to no resting tone other than the baseline neurologic synapses and stimulation to them. So if I look at things like biceps and triceps, if you're just sitting down right now watching this, yeah, you can move those things around and they give you next to no kinesthetic feedback. They give you next to no tension in them at all. But if you look at your jaw, if your masseter, temporalis, and medial pterygoid didn't have higher resting tone, what would happen? You'd be walking around like, ugh, and your jaw would be open all the time. Bugs would be flying in there, dirt all the time. So what are you trying to do? You're trying to go ahead and have that normal resting tone. But what happens is sometimes the switch gets flipped a little bit too far and you get excessive resting tone. Okay. So the excessive resting tone is you putting down, holding this tension right now. Right? Some people even do it when they're actually even weightlifting or something. They don't even realize it. They're pulling hard on something and they're looking down. One of the biggest things I give patients especially is the first thing you need to do in this new action is relax your jaw because you can see it right away.
That is so interesting.
Yeah.
So thank you. Do you have any other advice for people to know about jaw health or?
No, the only thing would be to make sure that you actually do, like anything else, you have to load a tissue to heal a tissue. My TMJ injury that I described earlier was fairly significant from that sparring event that happened, and it's fully recovered. It took about 5 weeks, 6 weeks for it to recover, but you've got to slowly work your way into that tissue, okay? The next thing would be is during times of injury, if you have significant pain, your body's telling you to take it easy, absolutely, but challenge it just a little bit. Try and push yourself a little bit into these areas of discomfort. When you know it's too much, you fade back. You can use this for any portion of any type of repetitive strain injury that anybody has. It's going to be a matter of modifying the causative agents and then going ahead and adapting it to that tissue-specific and patient-specific treatment that you want to give. Best practitioners are ones who give you more holistic treatments.
Yes, I'm in favor of that myself. I think drugs can be useful, but sometimes it's better to do things holistically.
Yeah.
Well,
And then
thank you.
the only other thing I'll add to it is if
Yes.
you want more information, we've got this book on the top 200 orthopedic conditions that you would see in practice. It's also readable for people with a higher background who can use it for themselves. And I'll just show this on the TMJ issues. We talk in detail about the TMJ, the articular discs, when it clicks, what does it mean? What are some treatment options? We go through all of those things in this. And we do it for pretty much every condition of the body when you're looking at musculoskeletal type injuries around the knee, all of that stuff. So carpal tunnel syndrome.
Fantastic.
Yeah. Yeah.
Well, thank you for coming on to the show, Dr. Nick. It was so great to see you and learn about the jaw. We really appreciate that.
All right. Thank you very much for having me.
And thanks everyone for watching RSI YouTube, and please subscribe and tell your friends.